Yeah. Okay. So this is going to be on our next lab exam, which is next week. So we're going to run through some of this. And some of this stuff, again, and I know we talked about it, you've seen some of the structures before, okay? And actually, I don't really think that the digestive system is all that difficult, especially when we're talking about some of the physiology behind it, but I'll let you be the judge of that, okay? It's easy for me to say it because I teach this stuff, but I'm going to try to present it to you in really kind of like matter-of-fact kind of terms, okay? So basically, when we talk about the digestive system, all right, I want you to think of a long tube, okay? And it starts at your mouth and it ends at your rear end, all right? And that's really what it is, you know, and there's a couple, I mean, and especially when if you were to take an embryology class, you'd really understand that concept a little bit more. But that's essentially what your digestive system is, all right? And we'll got to go through all of that, all right? So when we break down the digestive system, all right, we're going to have what we call the gastrointestinal tract, and that's going to be that long tube. And then we're going to have a whole bunch of accessory digestive organs along the way. Like in your mouth, you got the salivary glands, all right? And then as we move down towards the stomach and into the small intestine, we got the liver and the gallbladder, and the pancreas, all right? Those are going to be some of our accessory organs that are going to be producing secretions, all right? These exocrine secretions that are going to go into our gastrointestinal tract. It's going to help us to break food down, all right? So again, when we're talking about the GI tract or gastrointestinal tract, we're starting off with the mouth, going to the pharynx with the throat, and then our long tube that goes to the stomach, the esophagus, stomach, through the small intestine, out through the large intestine, finishing up with the rectum and the anus, and done. That's it, all right? So when we have, all right, this long continuous GI tract, all right, we have that tube, and it basically, all right, keep in mind, you're going to hear me use this term quite a bit, the lumen, the inner lining. And basically, what's going to happen there? We're going to break all that food down. All right, that is, if you remember back in the beginning of this of anatomy and physiology, we talked about different types of metabolism. Okay, you have catabolism, all right, which starts with something big, and you break it down into something small. And then you have anabolism, okay? And that's when you start with something small and make it big, like amino acids into proteins, all right, into cells and whatnot. That's anabolism, all right? We're going from something small to something big. But our body, when we're talking about digesting something, is catabolism. We start with something big, and we break it down. That's what we're going to do. You eat a piece of meat, all right, and then we break it down into proteins, and we break that down into amino acids. That's what we're going to see, all right? So we're going to go through that, all right? But before we do that, that's going to be more of the physiology. We're going to cover more of the anatomy here because this is lab, all right? So that's the GI tract, all right? So then we have our accessory organs, all right, which are going to include, like I said, salivary glands, liver, pancreas, all right? Believe it or not, your teeth and your tongue are also considered to be accessory organs there, all right? And that's funny to think of your teeth, all right? Yeah, actually there are. You'll be surprised. You'll be surprised. Whenever I'm at the dentist, they'll say like they'll throw out a number there, and I have no idea what they're talking about. I have an idea. I shouldn't say I have no idea, but I have an idea. But the whole point of these accessory glands or digestive organs, excuse me, is to break down food. They're going to help, right? Because it's not as easy as one would think. Yeah, all right, you think, all right, I eat something, I swallow it down, game over, and whatnot. And I'm going to tell you something, a story that I worked when I was in grad school. A roommate of mine, he used to work for a porta potty company, all right? So, and his job wasn't the most glamorous job, but his job was to empty out porta potties. And so he would tell me some very interesting things, and I won't discuss that with you. But one thing was Centrum. Centrum vitamins. Are you familiar with Centrum? It's a multivitamin. They did a huge campaigning blitz years and years ago, and you see it all the time. They have Centrum Silver now for seniors and all that. Well, he told me he would never buy it because it's garbage, because he would see Centrum pills in the porta potties. And I said, well, how do you know it's Centrum? He goes, because it says it right on the pill. You could still see it. The digestive system was not breaking it down because of these pills. So that's what he was saying. So if you're ever thinking about, I won't go into, that's what I was, you know what? I didn't think about that until after it. Yeah, well, there was issues like if something fell over. I don't know. I didn't really investigate how he was able to closely inspect it. But I took his word at it, all right, that it was a central pill, all right. But my point being is we need to break this down, and there's going to be a lot involved to break that down. Well, these accessory organs are going to help with that. All right, and so we're going to go through quite a bit of them today. So you can see here on our picture here, all right, on the left side here, you can see all the different accessory organs, the teeth, the tongue, all right, salivary glands, liver, gallbladder, and pancreas. All right, these guys here are going to make or secrete, all right, enzymes, products into our GI tract, into the gastrointestinal tract to help to break down those substances there, all right? So with our GI tract, we have 4 layers, or what we call tunics, okay? The innermost layer is going to be called the mucosa. The outermost layer is the serosa or the adventitia, all right? So the submucosal layer is the second innermost layer, and then you have the mainly muscular layer known as the muscularis, and then the outer covering is the adventitia. We're going to go through this. I'll actually show you a pretty good picture here. All right. So, and it varies depending on where we are in the gastrointestinal tract. All right. But you can see here, all right, here's our innermost layer, and that's mainly made up of epithelial tissue. All right. And then, of course, epithelial tissue always sits on top of basement membrane, but that basement membrane here in the mucosa will sit on top of the lamina propria. All right, and then we have another layer, the muscularis mucosa, sitting under that. Then our submucosa will be this tissue in here. You'll have these little villi here. We'll talk about those. All right, and the submucosa will see quite a bit of nerves. All right, the nerves will help to stimulate glands to secrete enzymes or whatever the product's going to be to help with the digestive process. The third layer here, all right, is the muscularis layer, which is made up of 2 different muscle layers. All right, one is a circular layer, so that almost acts like a sphincter type of muscle tissue. And then the outer layer is the longitudinal layer. That's going to assist with what we call peristalsis, the movement of the digestive material or digestive materials down the digestive tract, moving it further and further away from the mouth and closer to the anus. And then we have our outermost layer, the adventitia or the serosa. You can see it's just this layer here that's going to have our blood vessels. Because ideally, the food sits in here. We want to break it down and get it into the bloodstream, the lymphatic system. That's what we're doing, okay? That's what we got to do, because then those nutrients can then run all around our body and help, all right, for energy processes. So back in 210, in chapter 1, we talked about different serosus membranes, and here's another serosus membrane, all right, that we discussed, the peritoneum, okay? And this serosus membrane is going to be found in the abdominal pelvic cavity. And there's 2 layers, okay? The parietal peritoneum, all right, that's going to line the lining of the internal portion of the body cavity there, parts of the abdominal wall. And then you got the visceral peritoneum that's going to sit right on top of the organs inside. Okay, and there's a space between them, all right? Peritoneal cavity, all right? In this space, we're going to find our serous fluid there that lubricates, but basically what it does is it allows the organs to move freely upon one another, as long as there's no adhesions. I know this is going to sound weird, but has anyone ever had their hands in the abdominal pelvic cavity and moved around organs before? Okay, all right. Yeah, I've done it on cadavers, and I've only done it a couple times in an actual OR a long time ago. But again, now they're not bare hands, but I'm in there, moving around, and it's really true. That peritoneal cavity allows. Think about it, because the configuration and the shape of a lot of these organs, especially in your intestines, small and large, as you're moving food through, it has to be dynamic. It has to be able to change, all right, to accommodate food. Now, especially for you ladies, all right, with the possibility of childbearing, okay? Think about it. When the baby's there is growing and getting bigger, it's going to be moving things out of the way, all right? And if they were fixed into place, that would cause damage to the tissues. So it only makes sense. This peritoneal cavity allows for those organs and those structures to be moved out of the way to accommodate the growing child, all right, and not cause damage to the tissues. It's really fascinating, okay? All right. So we have this tissue here called the mesentery, all right, and this is where we're going to see, all right, like a double layer of peritoneum, kind of like where we saw, all right, in the brain, where we had the dural septa there, where we had that double layer of the dura mater, all right. So here we're going to have a double layer of the peritoneum, all right. And this structure plays a huge role, all right, in supporting a lot of your gastrointestinal structures inside, all right? And in this mesentery, we are going to see tons of blood vessels, nerves, and lymphatic vessels, all right? They're going to be throughout because a lot of this portion of the GI tissue, or tract, I should say, is folded on top of one another, all right? And the mesentery is going to be playing a role in there, and it also will have these folds in it, all right, and in these folds, that's where we're going to find these blood vessels and lymphatic vessels there in the nerves, okay? So we have the greater omentum and the lesser omentum, and I always think of the greater omentum as a fatty apron, okay? Because, and it's really cool, and I'll get to that point in a second here, it's primarily made up of adipose tissue, okay? And it basically hangs off. The stomach kind of looks like, all right, the stomach kind of looks like a bean, sort of like that, okay? And so this bottom portion here is the inferior lateral portion of the stomach, and it drapes off the stomach like this. And it covers, you'll see it if you do dissection, all right, when you first open up the abdominal pelvic cavity and you pull away the skin and the abdominal muscles, deep to that, you'll see this fatty apron. It looks like this, okay? So here's the greater omentum, all of this. It hangs off. Here's the stomach. This is the greater curvature of the stomach. It hangs down all over those smaller intestines there and parts of the large intestine. And it's really cool because the greater omentum, it will actually move around, all right, if there's an infection. And this thing will kind of move around on its own and kind of help fight off the infection with some of the tissue structures in that greater omentum there, okay? But it is going to cover pretty much most of the abdominal organs in the abdominal pelvic cavity there. All right. So we have a greater omentum. We're going to have a lesser omentum, and that's going to come off of that lesser curvature of the stomach. All right. And it's going to attach onto the liver. That's an awful picture, but you know what I'm getting at. Okay. So it's going to go from the stomach, all right, and part of the duodenum to the liver here. So you can kind of see it here. Here's the stomach, all right, here's the duodenum, and here is the lesser omentum, okay, attaching onto the liver. All right, so let's get up and let's start. What we're going to do is we're going to start with the mouth, all right, in the upper GI tract, and we're going to work our way down, okay? So we'll go mouth, pharynx, esophagus, stomach, and so forth and so on, all right? So we're going to include all the structures now. We're going to talk about some teeth, all right? And then we're going to get into some of the salivary glands and some of the other tissues that we're going to find there. Okay, so in the beginning here with the oral cavity, all right, this is where digestion begins, believe it or not, okay? Actually, some will say at the time that you start to smell something, that will stimulate the visceral reflex of salivation, and that's when digestion begins, right? Some nutrients are harder to break down than others. Proteins, for example, are bare to break down. So we got to start breaking them down. Starches, those are complex carbohydrates. We got to start breaking them down right on scene, right in the mouth. Okay? And that's what we're going to do. Okay? So here in the oral cavity, in the mouth, we're going to start, one, by chewing our food. Well, guess what? That's the mechanical digestion. Right? You're starting with something relatively big and you're smushing it down. You're chewing it into smaller bits. That's where we start to break a larger structure into smaller ones. All right? Now the saliva gets secreted during that, helps to lubricate the food, helps to form what we call a bolus, which is that actual kind of like ball-like structure that you're going to swallow down. But here's our first enzyme. All right? Salivary amylase. And we're going to talk about what these enzymes work on, all right, when we get into lecture, okay? But for right now, all right, we're going to start to secrete our saliva, start to secrete these enzymes that are going to get to work and start breaking down, All right, in this case, the amylase will start to break down the starch. But what's important is we're going to start to mix the amylase through the chewing process, all right, or the saliva through the chewing process, mixing that through, okay, and we start to break things down, and we're going to start to coat that material, all right, and make it easier to swallow, okay? So we start to form that bolus there. And we're going to start to move it to the back of our mouth. Our tongue's going to help with that. And we are going to move it into the pharynx there, all right, which is that funnel-like structure, all right, that we see that runs down the back of your throat, all right? At the same time, we do have some mucus secretion because, again, mucus will help with lubrication and protection, all right? And we have that mucous membrane that we saw in the nasal cavity. That's not part of this, but we also have, not in the nasal cavity, in the nasal pharynx, you're going to have mucous membranes in the oral pharynx and the parts of the larynx there, okay? All this is to help us to swallow, okay? We're going to swallow that bolus down and move it down into the esophagus and eventually into the stomach. So that's what we see here, okay? Now that bolus moves, all right, down this long tube. The esophagus is almost about 12 centimeters long, all right? And during its time as it's traveling down the esophagus, it is lubricated. That bolus is lubricated with those mucus secretions, okay, to help prevent damage, all right? So, oh good, it's not up here. So what type of epithelium lines the pharynx and the esophagus? Just take a guess. And you don't even have to be really specific. Go really general. Do you think it's, you don't even have to say the cell type. Do you think it's simple or stratified? Damn right, stratified. Yeah, darn right. If it was simple, you'd be tearing those structures apart. One single cell layer? That's bad. Yeah, that's bad. That's right, Morgan. It's stratified. Okay, so that's what we're going to see. We're going to see stratified epithelium in places that are going to come in contact with the food, like your mouth. Your mouth is lined by non-keratinized. That means all those cells are living. Non-keratinized. You'll find non-keratinized stratified squamous epithelium in moist places. I know that word freaks some people out. All right, areas where there's moisture. Okay, so think about that. In your mouth and your throat, you're going to see the non-keratinized, and you're going to see non-keratinized kind of scattered throughout. Okay, so all right, so that bolus then enters into the stomach, and then it gets mixed around, and we'll go through all the cool, really neat types of gastric secretions. You got some hydrochloric acid in there. You got all this other stuff in there. We got to start to break this stuff down. We got to make it small into small molecules so we can absorb this stuff. We got to do it in a hurry because we're going to start breaking that stuff or absorbing that in the small intestine. All right. So what helps us to mix in all those secretions? Smooth muscle. We got smooth muscle. Remember, your stomach is one of the organs that has all four tissue types. It's got epithelium, all right? It's got connective tissue, and then it's got muscle and nervous tissue. All right, all of those are going to help, all right, with the actual function of the stomach, which is going to be to make secretions, to break the food down, and then to mix the food up. Now, while it's mixing, think of it like a cement mixer. You ever seen those trucks rolling down the road or at a construction site? They have that big barrel on the back of it. It's spinning around all the time. Because if it stops, the cement inside will dry out. All right, well, that's what your stomach's doing. When there's food there, it's constantly churning and mixing, and it's trying to swirl everything up. All right? At this point, we're no longer referring to that food product as a bolus. Now it's chyme. All right? And then the stomach will empty that chyme into the duodenum, which is the first part of your small intestine. Okay, remember, there's three parts of the small intestine. The duodenum, all right, the jejunum, and the ileum. Okay? And the duodenum is still considered to be a part of the upper GI. Okay? After the duodenum, now we're going into the lower GI. Have you ever heard of somebody that might want to have an upper GI study done? All right? That's the upper GI. All right? The mouth, the throat, the esophagus, the stomach, and the duodenum. Lower GI is going to be the jejunum, the ileum, all the way to the anus. That's the lower GI. Okay? All right. So let's get specific now. Up into the oral cavity here of your mouth. All right? So there's two regions. All right, so you have the overall oral cavity, and then it has two smaller areas. The vestibule, All right, and the vestibule is the space in between your teeth and your lips. Okay, so if you ever pull your lip out, all right, that space in between your teeth and your gums and the lip is the vestibule. I didn't even spell that right. What was I doing? Vestibule. All right, and then you actually have the oral cavity proper there. Okay, so that's that space between the gum, lips, and cheeks. The oral cavity proper is pretty much everything behind the teeth. All right, back to the oral pharynx. Okay, so a lot of the chewing, all right, or the mechanical digestion is going to occur in the oral cavity proper. Remember this guy? If you play the trumpet, you have a really nicely well-developed buccinator. All right, but the buccinator is that cheek muscle, and as you're chewing, it kind of contracts a little bit to hold your cheeks in. Otherwise, you'd be like a squirrel, and your cheeks would puff out, and the food would fall out, literally, not out of your mouth completely, but it would fall out of the oral cavity proper into your cheeks. So the buccinator helps to keep your cheeks against your teeth. Hopefully you're not biting your cheeks, so it keeps the food over your teeth as you're opening and closing, as you're masticating. Okay? It's really, really an important muscle. Okay. So when we talk about the lips, there's another muscle, orbicularis oris. That's the muscle that allows you to pucker your lips there. All right. So their job. No, first of all, before I go on, all right. Here is an example. All right. When we're talking about the tissue here that makes up the lips here, you can see that the lips are not going to. They have a different color. Okay. And again, that color is because there is keratin present, but it's not a lot of keratin. It doesn't matter, a lot or a little. All right, keratin kills those cells. All right, so we're dealing with keratinized tissue. All right, but the reason why they have that more red appearance involved is because of those blood vessels underneath, just like your nail bed. Okay, but they are keratinized, so it's pretty much very similar to the skin of your face. All right. But there's that transition as we move back onto the lip, as we get into the internal surfaces here, all right, as we move more towards the gingiva, all right, towards your gums, then we're going to see, all right, that transition from the keratinized stratified squamous epithelium to the non-keratinized, all right, stratified squamous epithelium, okay? So when we're dealing with the lips, you have obviously a superior labia, the upper lip, and then you have an inferior labia, the lower lip. And if you've ever noticed, you ever pull your lip out and you see this little slab of skin right at the middle there, that's this guy, the frenulum, labial frenulum. All right, you have one on top and one on bottom. It's right there in between at the center of your teeth. I'll show you a cool picture. There it is. All right, so this is your upper lip, okay? So that's the superior labial frenulum, and then here's the inferior labial frenulum. And I think some people get those pierced, you know? Yeah, I mean, if there's skin somewhere, you're going to pierce it, all right? I'm sure it's probably been done. Yep, and I know some people have to do that, and and we're going to talk about the lingual one. There's one there. If you lift up your tongue, you notice you've got a frenulum there too. All right, and there's some folks that have to have that clipped off too, or not clipped off, but drawn back a little bit because they're having issues with speech, or they're not able. Their tongue is too small, and they're having issues. What did you say? Yeah, do you guys do it there? Yeah. I just think about that. I don't know. I'm weird like that. The top one? Really? Well, I've looked and seen that some people actually get tattoos on the inside of the lip. Have you seen that?
I'm afraid that
Yeah.
it will go away.
They will go away?
Yeah.
Oh, all right. Huh.
Yeah, it's always running.
Yeah. Oh, yeah, exactly.
I'm still wearing it. She works with me.
All right, so we talked about the lips. That's the outer portion there of your mouth, okay? Underneath, we have the orbicularis oris muscle. Now, a couple of boundaries of your mouth. On the top portion, or what we call the roof of your mouth, all right, or the palate, all right, you have a hard and a soft palate. All right, the hard palate is going to be made up of, remember, the maxillary bones, all right, or the maxilla, and then the horizontal plate of the palatine bones. It's made up of two different bones, okay? The anterior 2/3 is made up of the maxilla, posterior 1/3 is going to be the horizontal plate of the palatine bone. So that makes up the hard palate, the roof of your mouth. Again, it's very helpful because sometimes if you're chewing food, you can smash the food against the hard palate there, and you can help to break it up. All right, we're going to talk about some of that cool stuff in a second. All right, so the palate is basically, yes, it's the roof of your mouth, but it's also the floor of the nasal cavity. Okay, and then on the posterior portion of your palate, you have the soft palate. All right, and that's where we're going to see, all right, the uvula hanging down at the end. That's that little punching bag thing, all right, that we'll talk about. Okay, and that there's underlying muscle in there. Okay, because that muscle, when you're swallowing, elevates and it blocks off the nasal pharynx so food or liquid doesn't go up into your nose. Okay, there's always a way to try to keep problems from occurring, and that's one of them. So when we get into the hard palate here, all right, the maxilla and the palatine bones here, and then if you notice, and you can take your tongue right now, no one can see you, we're all wearing masks, and you can rub it at the top, at the roof of your tongue, the roof of your mouth. Do you feel if you go towards your teeth, there's like some rough ridges there? All right, those rough ridges are the transverse palatine folds. And again, those folds are there as your tongue can manipulate the food around. All right, it helps with, all right, the breaking down process. If you need to flip something around in your tongue or move, you know, like a piece of whatever you're eating and try to turn around, those ridges there, all right, are there to help with manipulating the food. Just like on your tongues, you have the papillae. Remember those little bumps on your tongues? Some of the papillae have taste buds. The majority of the papillae do not. And their purpose is to make the tongue a little bit more rough, like a cat's, not like similar to a cat, all right? But it helps to manipulate the food. It creates friction, okay? All right, so the uvula, all right, that's that little punching bag that hangs down at the back of the soft palate here. All right, and again, its job is to close off that opening there to the nasal pharynx so no materials go up into your nasal cavity, all right? Because, well, if you ever had food or liquid go up there, if you've ever laughed really hard, I know I've seen people, like literally milk come out of somebody's nose. All right, so if you have your atlas, you might want to, if you haven't labeled this area here, okay? Here you can see the oral cavity. This is where all the magic happens for the mechanical digestion, okay? And then here are those palatine folds here, these transverse palatine folds, all right, that I was talking about right behind the teeth, in which you can use those to help manipulate the food there.
What is this view?
This is a sagittal view. So here's the nasal cavity up here, all right? And it's basically,
So that's the front.
oh yeah, this is the anterior. Here's your nose. Here's your nose. Here's your lips. So this is basically, I chopped your head right down the middle. Your eyes are over here, okay? All right, so here's the front, your lip, your superior labii, and then just behind it, there's this little space here in between your teeth and the lip, all right? And that's going to be the vestibule, okay? Then we move behind the teeth. This is going to be the oral cavity proper. Here's your hard palate. All right, the anterior 2/3, that's the maxillary bone. And then the posterior 1/3, that's going to be the palatine bone. And then you're going to have your soft palate, all right, back here, okay? So right here where you see some muscles, all right, that's the soft palate, and then where it kind of hangs down, that's the uvula, the little punching bag thing. And you can see, all right, so when you start to swallow food, all right, this will raise up and block off this area here to the nasal pharynx there. So none of the contents go up into here. All right, so when we were talking about the nasal cavity, we talked about these openings here, all right, at the posterior region of the nasal cavity. All right, in the oral cavity, you've got these openings also called the fauces. You thought I was going to say Fauci. All right, close. All right, these are called the fauces. Okay, so these fauces are going to be these openings here between the actual oral cavity itself and the oral pharynx. And there's two arches. And it's interesting because both of these arches, underneath the mucosa, you have muscles named for that arch. So for the anterior one, you have the palatoglossal arch. Well, the muscle underneath that is called palatoglossus. Okay? And the same thing with the palatal pharyngeal arch, which is the more posterior arch. All right, the muscle under that is called palatal pharyngeus. Okay, so they're just those muscles that sit right underneath the mucosa there. Okay, and then you'll see in those arches we have our tonsils, which we know what tonsils are. Those are secondary lymphatic structures, all right, that house our immune cells. Okay, so here you're starting to see one of our first lines of defense. Okay, right there in the mouth, which makes sense because you're taking an external item from the environment and you're going to start to introduce it to your internal environment. So we have, all right, our first line of defense sitting there, all right, prepared for that. All right, well, I can't talk about the oral cavity and not talk about the tongue. Okay, so a lot of the tongue we already talked about when we did special senses for taste, all right, but pretty much the tongue, all right, is made up of skeletal muscle. All right, there's several different muscles. The largest is the hypoglossus muscle, which is innervated by your hypoglossal nerve, cranial nerve 12. Okay, so it is skeletal muscle, which means it's voluntary. We can control it. All right, so on top we have all the papillae there. Some papillae will have taste buds in there. All right, but we will see tonsils, the lingual tonsils, which we saw in chapter 22 when we were doing the immune system there. All right. We will see those on the back portion of the tongue here, okay? And if you look underneath the tongue, you lift it up, you'll see that the lingual frenulum, that little piece of tissue that helps to anchor the tongue to the floor of your mouth there, okay? All right, so it has a couple different roles, all right? One, it helps to move food around and manipulate that food and place it, you know, against your teeth or under your teeth, all right, when you're chewing. Also helps to mix things up, helps with speech, okay? And obviously, that's where your taste buds are, okay? So it's going to help with actual taste and swallowing. All right, so, well, actually, let me show you this one here first. That's not it. That's it. All right, so now we can see through an anterior view here, okay? Here we have the palatoglossal arch, all right? Then you got a little space, and then behind it is the palatal pharyngeal arch. But in between those two arches, here you can see the palatine tonsils, on either side, all right? The uvula is hanging down from the palatoglossal arch, that soft palate region there, all right? And then you can see as we're lifting up the tongue, here is the lingual frenulum, all right? That little bit of tissue that anchors, all right, the tongue to the floor of the mouth here. All right. Here it is on the lateral view. Okay, you can see primarily all these muscles that contribute to the tongue. There's several of them. Hypoglossal, styloglossus, many, many, many. Okay. All right. So you've got your, if you got your if you have your atlas, all right, let me run through here. This is, again, another sagittal cut here. So here's the superior labia, inferior labia, that space in between. All right, there's the vestibule. Here's the oral cavity here. All right, number 8 is indicating the tongue. And then over here on the posterior portion, here's the pharynx in all 3 different parts. The oral pharynx is superior, the nasal pharynx is superior to the oral pharynx. And then as we move from the oral pharynx, we go further down to the laryngeal pharynx, which is just posterior to the larynx here. Does anyone remember what this structure is right here? Close. It's above it. It's the thigh. It's the epiglottis. That's the epiglottis. So again, as food is rolling down, it pushes the epiglottis closed, and that will close off the opening here to the trachea, the glottis. All right, me being me, I like to talk about the histology, all right, even though I hated the class, okay? But the histology for the oral cavity, like I said, it's going to be a stratified epithelium. In this case, it is non-keratinized stratified squamous epithelium, okay? Non-keratinized. And why? Mechanical stresses are best suited, or the best suited epithelium is stratified epithelium. Okay, so stratified squamous epithelium will help with all the abrasive forces from the process of chewing, okay? Because it's banging around in there. Okay, so let's talk about some of the salivary glands here, right? We know what their job is. We're going to make saliva to help moisten the food, lubricate the food, and help to start the digestive process, okay? So you have tons of these small little glands. These are the intrinsic glands. They're unicellular glands. Well, there's another example of a unicellular gland that we saw before, and that's the goblet cell, okay? We know that the goblet cell, all right, are those small, tiny cells that we've seen in the pseudostratified ciliated columnar epithelium, all right? And we've also seen it in the non-ciliated simple columnar epithelium down in the small intestine, okay? But these glands are what help to keep your mouth wet, okay? So we don't need food for these glands to be operating, okay? So when your mouth is continuous, because you're not always salivating, right? But your mouth is wet, and it's because of these glands. Well, they're the ones that are going to make lipase, LIP. What do you think that digests? Lipids. That's right. That's right. So we're going to start our lipid digestion up in the mouth too. All right. So we saw starches getting broken down up there with the salivary amylase. All right. Now we're seeing lingual lipase. That's going to help to start to break down lipids. All right, out in the mouth. All right. So those are the intrinsic salivary glands. Now we have the extrinsic, okay? These are the ones that are not going to be inside the cavity, okay? So these three, parotid, submandibular, and sublingual, okay? The largest of all of those is the parotid gland. This is the one that gets infected with mumps, all right? But yet, even though it's the largest, it doesn't make most of the saliva, okay? So this is the one that sits right in front of your ear, okay? And it has this duct, okay, that goes from the front of the ear and it crosses over the masseter muscle and it goes to your second molar on the top of your mouth, okay? This duct is also called Stenson's duct. All right, we'll talk about that in a second. But if this gland gets infected, mumps, okay? All right, so
Get vaccinated for that?
for the mumps, oh yeah.
Yeah.
MMR,
Yeah.
measles, mumps, rubella. Which I know there was a resurgence of measles. I don't think I've heard anything recently. This was a couple of years ago, I think, which is good. I think everything's decreased in, except for COVID. Yeah, it's all COVID. All right, so the other two types of glands are the submandibular and the sublingual. Well, their names kind of tell you where they're located. All right, submandibular is going to be the gland that's going to produce most of the saliva, okay? It's going to be along the body of the mandible. What's the body of the mandible? That horizontal portion of your jaw, but it's going to be back more towards the angle of the mandible. That's that kind of corner there of your jaw. Go about a half an inch anterior, and that's where you're going to find, all right, the submandibular glands there, okay? They're going to be closer, well, not closer, but they're going to be on the floor of your mouth here. Okay. Then we have the sublingual glands. Okay. These are going to be more towards the medial portion, but more towards the front, all right, of your oral cavity. And they make very little saliva. Okay. I'll show you a nice picture there. All right. Just a quick review with the histology here of the glands. Real quick. All right. We got two types. All right, we've got mucus cells and serous cells that are going to help to produce the secretions for the salivary glands. All right, so obviously the mucus cells are going to create that mucus there that once, remember, mucus comes from mucin, which is a glycoprotein. And how we make it, we just add water. It's like Kool-Aid. You want to make Kool-Aid, you add water to it. You want to make mucus, add water to it. Okay, that's how we're going to make the Kool-Aid of our mouth. We're going to add, all right, some water to the mucin, okay? And that's what the mucus cells produce. Now the serous cells, these are the guys that make up that beautiful electrolyte compound, okay? Sodium, potassium, magnesium, chloride, all that will be secreted in there. It's mainly going to be that watery type, so that's going to kind of give us that liquidy sensation there. All right, but also they produce amylase. What's that going to break down? Starch. Starch. Okay. All right, so let's check out a. All right, so here's where we're going to see. Here's the parotid gland right in front of the ear, and then the parotid duct going all the way to the superior second molar back here. Here's that masseter muscle. This is the muscle that hangs out on the ramus of the mandible. This is the most powerful muscle of mastication. This does a lot of work here. Okay. So there are other two types of salivary glands are going to be here. There's the submandibular gland. All right, again, it's along the body of the mandible, back closer towards the angle there. And then the gland that's more anterior, a little bit more medial, is the sublingual gland. And you can see all the little ducts here, right here on the floor of the mouth. So let's look in our book. Do you have that one? Is that picture in your atlas? I can't remember if it was or not. This guy looks like he's scared of something. Well, if it's not, just keep in mind, here's the parotid gland right in front of the ear.
Really similar to it.
Oh, okay. Does it have a parotid gland on it?
Yeah.
Oh, okay. So then here you can see, all right, that Stenson's duct or the parotid gland duct or parotid duct goes right across the masseter. All right. Does anyone remember the name of this muscle? Yeah, all right. That's the else. And here's orbicularis oris. There's that huge muscle there. All right, I don't want to bring back bad memories. All right, let's jump into the salivary gland. Okay. So again, basically, this is a mixed type of gland. All right, meaning you have certain cells that are going to produce the mucus, and then you have certain cells that are going to produce the serous fluid. All right. Point being is they all mix here into the duct and then gets excreted out into the salivary duct themselves. We're ready. Let's talk about a tooth. Here we go. For those of you that are planning on going into, I still get nightmares about losing my teeth. Does anyone else get nightmares about? I asked my dentist about that. Did I tell you guys that? Yeah, I asked my dentist. I was like, is that weird that I have nightmares about my teeth falling out? And he goes, no, it's very common. But then somebody looked it up in a dream journal one time and told me that you're afraid of losing something, or I don't know what it meant. Well, yeah, I know. I don't want to lose my teeth. Well, I don't know if you know this, but I'm a ginger. And so redheads, some, not all, carry a gene that allows that certain anesthesia does not affect them as much. And I unfortunately happen to be one of those people, so I have to get like 3 shots of Novocaine or certain painkillers. Yeah. Yeah. Yeah, it happened to a patient of mine too. Yeah. Yeah.
Pain level is different.
Yeah.
Tolerate pain more.
Yeah, I got issues. I got issues. All right. The sun doesn't like me. Drugs don't like me. You know, there's all sorts of stuff. All right. So we're going to break down and talk about the different parts here to the teeth. All right. So the 3 portions we're talking about the average tooth. The part that we see in somebody's mouth, that's the crown. All right. And then the part of the tooth in which the gums actually will brush up against, that's going to be the neck. And then the similarly like the hair, part that's underneath the skin, well, in this case, the part that's embedded into the jaw or the bone itself, that's the root. Okay. And then we're going to talk about all this other stuff here, the enamel, which is the white covering. All right. Followed by the dentin, which is this kind of, I don't know what color that is. Does that look gray to you? Brownish? Tannish. All right. And then you've got your pulp with all the, we'll get into that, all right, because I got the model that we'll use. All right, so you got baby teeth and permanent teeth. The baby teeth, we call those the deciduous teeth, all right? So around, it varies from person to person, all right? But starting around 6 months, these will start to come through. And you only have 20 of them, all right? Not many. Compared to your permanent teeth, all right? You got 32 permanent teeth, all right? And these teeth will push out the deciduous teeth, all right, and hopefully be your permanent teeth that you will never lose and hold on to for the rest of your life. Okay? So we have I've never heard of this before. The third molars are also called wisdom teeth. Did I ever tell you folks the story about me pulling somebody's wisdom tooth out? I told you that. I think I told some of you in my 210 class. Yeah. So, anyways, yes, yeah. Okay, so we'll talk about the wisdom teeth here. I don't have. Does anyone here not have wisdom teeth? Okay, well, so no, I mean, I've never had. They've X-rayed me, and I have no wisdom teeth. Yeah. Mine never grew in. Thank God. You know what that means? We're just further evolved. Yeah. I don't know. That's what I tell people. Is that what they say? All right. So the types of teeth that we have, all right, when we're talking about deciduous and permanent teeth. All right, first of all, you've got your incisors. These are the ones that are going to be in the front. You got 4 on top, 4 on the bottom, okay? And again, these are the ones like you're going to bite into something. These are the teeth that you're going to do it with to help to slice into things really nicely, unless it's mashed potatoes, okay? Then you have your pointy teeth. All right, we call those canines because they're really pronounced on dogs, but if you see them on some folks, they have that nice pointy. All right, they're going to be just lateral and further back, so posterior lateral to the incisors. And again, their job is to help tear into things or puncture whatever. How many times have you used those teeth to kind of rip open a bag of something? You know, like potato chips. I use it all the time. Grab it, all right? And then just posterior lateral to your canines are your premolars, okay? So relatively flat crowns there, but you're going to have these cusps or these prominent ridges. And again, molars, premolars, their job is to grind that food down, grind it up, all right, and then really smash it down. And then your tongue helps to mix it up with the saliva there, all right. So then behind the molars, all right, the premolars are our molars, all right. Normally you'll have 2 of those, all right. These are the ones that are going to be large and pretty flat, all right. They will have, all right, some cusps on them, all right. But again, their job, grind things up, crush them up, okay. So when we talk about the mouth, all right, and I'm not in the oral medicine, all right, but they do it with quadrants, okay? So in each quadrant, you're going to have 2 incisors, 1 canine, 1 pointy tooth, 2 premolars, and 3 molars. That third molar is included is the wisdom tooth, okay? All right, so we're going to look at the teeth here in a second, all right? But we have our gingiva or gums, all right? That's going to be that soft tissue that is going to be surrounding the teeth, all right, as they insert. Does anyone remember the type of joint that a tooth is in the jaw? Gomphoses, right, all right, good job. Yeah, look at you. Look at Brad with the big brain.
I just remember your story about something about your daughter telling her
to ask her dentist about,
yeah.
And she never will. She's like, Daddy, you're being weird. I was like, just ask him how your gomphoses are. All right, anyways. All right, so we're dealing with the gums here. Dense irregular connective tissue, good to know. That means they can withstand. It's a relatively tough tissue. All right, so we're going to see a non-keratinized stratified squamous epithelium. All right, and it's going to be covering, all right, the neck of the teeth here. I don't have a picture. Oh, I do have a picture. We'll see that in a second. But let me just show you the deciduous teeth here. All right, here's your baby teeth. Okay, I had a chart for a long time in our old house up in New York that had when these teeth were supposed to come in and whatnot. Okay, so you'll see, all right, that the anterior teeth will come in first, and then as you get older, the more posterior lateral teeth will start to come in. All right, now you can see in your permanent teeth what that's looking like here. Okay. So those wisdom teeth can come in later. Well, I'm way past the age of 25, and so if they haven't come in now, they're never coming in. And they've done that X-ray on my head. They're not even in there. All right, so let's check out here. Okay, I know this is in your lab atlas here. So let's review the regions here. All right, so this white part here that's going to be above the gum line. All right, that's going to be the crown. All right, and then the part in which the gingiva or the gums kind of butts up against, right in this region here, where you can start to see the tapering here, all right, as the tooth kind of tapers in slightly, that's going to be the neck. Then obviously below the gum line, all right, majority of it will be inside the mandible or the maxilla, all right, and that's going to be the root. Okay, know those. I guarantee you will see a good number of teeth questions. Not a lot, but a good number. Okay, I mean, yeah, but these aren't too bad. I think the teeth one are really. I mean, wouldn't you rather write pulp instead of levator scapula, or levator labii superioris aliquinasi, all that? I mean, yeah, this would be way better. Pulp, I like that. Okay, so now when we're talking about this white structure here, all right, that's the enamel. And I didn't know this. I think my dentist told me this, but as you get older, your enamel hardens. All right, it gets more hard as you get older. That's pretty cool. All right, so you should have fewer and fewer cavities as you get older, unless your diet's garbage. All right, I love gummy bears, and I ate a whole bag of them the other night. Wait, pretty.
You love Fruity Pebbles.
Oh, I do. Oh yeah, gummy bears, Fruity Pebbles. Oh man, that's yeah, love that stuff. All right, so now as we go, all right, further down, all right, you can see here's the enamel. All right, now we're going to move into. Oh, here it is. All right, that looks a little bit off-white there. All right, that's going to be our dentin right here. All right, and then you can see as we move here, all right, to this kind of, I don't know, that looks grayish to me, or grayish-white. All right, that grayish-white tissue, that's the cementum. And I always think of the cementum as cementing the tooth into the bone. Okay, that's how I remember it. And then this kind of reddish portion with all the blood vessels, that's our pulp. Okay, and then you got your pulp cavity in there. I didn't forget to show you this right here. Okay, the internal portion of the jaw. All right, so you can see here we have our two sets of incisors. Then we have our canine. All right, this is just one quadrant. And then our premolars, or the bicuspids, and then our three molars back here. Here's the gums or the gingiva. All right, and then right below it, okay, here are the ducts from the sublingual gland. Okay, here's the sublingual gland right here. All right, and it has tons of little ducts here. And then here you can see the submandibular gland. All right, and then here's its duct, the submandibular duct, or you can call it the Wharton's duct. That's a cool name, ducts of Rivinus. It's like yes, ma'am. Go ahead.
So my dentist told me that if your salivary glands are like more active,
Huh? I'm wondering if that's
your like your mouth that doesn't say like it's just a more like you're more prone to cavities.
Wait, say that again.
Like if your mouth, like if you have chronic dry mouth,
Yeah.
you're gonna have a lot more cavities.
See, that would make sense to me, But also, I have to
Because
believe.
it coats their teeth and it kind of washes it away.
Right, and
Whatever you eat during, it'll kind of wash it away. But like if your mouth is dry, whatever you eat or drink just sits on your teeth.
and also part of that too is going to be, because think of it also that it's going to be kind of flushing out that area, and saliva does have antimicrobial properties to it, so that also will help too.
When you see somebody that has like a lot of decay, you'll normally say like, well, you can kind of tell when someone's mouth is dry, but it's usually not done medication.
Well, I was also told by a dentist too that genetics plays a role. I think that's the new default excuse. Like genetics plays a role in everything,
A lot of it's like medication, but we've seen
Right.
a lot of stuff too where it's coming out now, like with Adderall, it's like dry in your mouth. And
Oh, really?
people are having issues with that.
I swear it's genetics.
No, there is a
Brush
big
my
component.
teeth twice a day and my mouth is total garbage.
Really?
Yeah, I've had 7 root canals, 11 cavities, 2 teeth extractions.
Really?
Yeah.
There's no doubt in my mind. There's really no doubt in my mind that genetics does play a role, because they're finding out. I mean, when I was going to grad school and they were saying that back pain, they're speculating it's genetic. I'm like, that's garbage. I don't believe that. I didn't, because there wasn't any evidence to support it. But now there's tons of evidence out there. I was like, You're telling me that there's a bad back gene out there, you know? I'm like, show me where that is. But, you know, they're fine. It's true, though. It's really true, though. So I'm saying, keep an open
Now
mind.
they're trying to break through your face with like cardio.
Yeah, you know.
I think has terrible acid reflux, and he has cavities all the time.
Yeah.
It's from acid reflux, so it's not anything else.
Yeah, but that acid reflux will tear apart that enamel. Yep.
Yeah,
I think probably ridiculous.
yeah, he has this prescription strength, acid reflux medicine.
Really?
Yeah, because he's had such bad acid reflux since he was a child. So he
I could
has
see
that.
Yeah, I can see that. That's awesome. Way to stop the class today. No, because I would love to. I want to get into the pharynx and the esophagus, but let's stop here. Yeah. Let's stop here today. All right, because we're going to get into some good stuff on.